Welcome, graduates, family, and friends, to the 2020 Oregon Health and Science University and Portland State University School of Public Health graduation ceremony. Thank you for joining us to celebrate our students. I'm David Bangsberg, Dean of the School. I welcome you on behalf of our two partner universities and on behalf of our Associate and Assistant Deans, Program Directors, faculty, and staff, who are all deeply committed to your success. Today is our fourth commencement ceremony as one school combined by two universities. We have 5 students graduating with a PhD, 78 graduating with a master's degree, and 4 with a graduate certificate. And we have nearly 370 students graduating with a bachelor's degree, every one of whom makes us very proud. I also want to acknowledge our graduate students, partners, families, and friends joining us today, whose encouragement and support were invaluable in the achievements we celebrate here today. Thank you. Graduates, you are the reason we are here, to celebrate your success, your hopes, and your aspirations for the future. You are joining the field of public health at a very critical time for our city, for Oregon, and our nation. Now more than ever, the world understands that public health matters and that people's lives truly depend on it. As you know, at the same time, we are facing one of the greatest health threats of our lifetime with the COVID-19 virus. We have also come to face another equally deadly health crisis: racism. As a school of public health and as public health professionals, it is our responsibility to both recognize and address the devastating impacts that systemic racism, oppression, and state-sanctioned violence have on the safety, security, and health of communities of color. Today, we need you, our future public health leaders, now more than ever. We need public health practitioners, scientists, educators to move upstream to confront the legacy of these injustices at the population level, address the social determinants of health, reverse the toxic stress of racism and other forms of hatred, take on mental health and substance use, suicide, gender, transgender equity, and more. You will also be called to solve the problems of tomorrow that we do not yet realize today. But I believe that our future is brighter because of your commitment to change and your belief that we have the power to shape a healthier, more just, and more equitable world. No matter where your degree takes you, whether you become a health administrator, a researcher, a data analyst, an educator, or a policy advocate, you will help ensure that everyone, no matter who they are or where they live, has the benefits of health and well-being that we all equally deserve. It's an important charge and a real responsibility, and you are up for the task. There is much work to be done, and you are ready. You are ready to take what you learned here in your studies to make this a better world. And I personally am very grateful that you will be out there helping lead that change. And now, I have the great pleasure to introduce you one of our leading public health professionals, our keynote speaker today, Ms. Rachael Banks, Director of the Multnomah County Public Health Division, whose teams promote the health and well-being of all residents of the county our school calls home. Rachael, we are grateful for your presence here today and for all that you are doing for our county, state, and the region.
Wow. Congratulations, 2020 PSU OHSU Public Health graduates for 2020. I am so excited for you. I am so proud of you all. My name is Rachael Banks. I use she, her, hers. I'm your public health director here rooting you all on. I want to thank Dean Bangsberg for inviting me to be one of your keynote speakers, and also want to thank all of the staff, the professors who have nurtured and supported you. I want to give special thanks to a couple of my colleagues who've been on the front lines with us, leading with race inclusively. Dr. Kelly Gonzalez, thank you for your many years of partnership with Future Generations Collaborative, as well as our Black, Indigenous, and People of Color Data Group. And Dr. Ryan Petteway, who's been part of our Multnomah County Public Health Advisory Board and Ethics Committee. Your insights have been invaluable. But most importantly, thank you to you all. Thank you for picking the world's best career at the most important time of our lives. We need you. Multnomah County needs you, the state needs you, our country needs you, and our world needs you. The work that you're going to do in public health will change our generation as well as future generations to come. So if you are a community health worker or promotora and want to work with community-based organizations, we need you. Our trusted institutions here are working day and night at capacity, serving the basic needs of our valuable communities. If you're an epidemiologist or a data scientist, we need you to understand this pandemic, past pandemics, and ultimately to have good data disaggregated by race and ethnicity, and to have the context of that data so that people don't use it to harm communities. If you're a communications person, we need you. The world needs information, and we need culturally nuanced strategies and different ways to get information out. If you're a policy person, we need you. We've seen the impact of public health policies on flattening our curve. And we need, in the future, as we respond, to have those public health policies to help guide how we should reopen and recover and rebuild. If you're an MPH track, we need you. We need you to train as a health officer. We need you to help us understand the disease. And if you want to come work in governmental public health, there are a variety of things that we do. And while we're focused on responding to this pandemic, we know that we need to prevent chronic diseases and injuries every single day. And finally, if you're bicultural and bilingual, Multnomah County Health Department needs you as we build a contact tracing team that matches the needs of our community. So congratulations. As Oregon's built this modernized public health system, I couldn't be more proud of the work that you all are doing. You are so amazing, and I look forward to working with you all in the future. Congratulations.
I plan to use my degree to help my community, which is the Tulalip Indian Reservation, where we're at right now, and I also plan to pursue an MSW this fall at the University of Washington.
My name is Kamisha Manley, and I hope to use my master's degree in public health to improve access to quality mental and behavioral health services.
Yat'e, hello. My name is Selena McCrae, and I am a member of the Navajo Nation from Vicente, New Mexico. I plan to use my public health degree by creating community-based, culturally appropriate interventions with tribal communities.
I am grateful for being a part of the OHSU PSU public health community and for the knowledge I gained, which helps me to be a competent public health professional, better protect environmental and human health, and be more useful in the world.
Hi, I'm Cypress, and I plan on using my public health degree to further my education to become a family counselor that specializes in addiction.
I plan to use my public health degree by creating a health program to decrease health disparities in the Latino community and impact lives.
I plan to use my health service administration degree to break all barriers and disparities in making healthcare accessible, especially for populations that need it the most, and eventually make it to dental school.
Hi, my name is Mohammed Irad. The threat and spread of infectious disease has never been like this. I race to reduce this infectious disease by preventing the spread of disease to my family, community, and the world.
As a female who's coming from the Middle East and is familiar with the issues that the misrepresented and underrepresented families are going through, I am hoping to become a nurse one day and be able to reach out to those communities and help them out. Now, it may sound like a dream, but I will make that dream come true one day.
My name is Aini Amir, majoring in public health and community health promotion. I will be using my degree to help immigrants, refugees, and build healthy living in communities.
Hi, I'm Katie. I plan to use my healthy aging public health degree to work with the elderly through fitness and activities to improve their quality of life.
Hey Vikes, what I plan to do with my degree to make a change for my community is be a role model for first-generation students that may be unsure and overwhelmed. It's your path, you can do it.
No! I want to educate other communities as a health worker on eating healthier, exercising, and improving their overall environment. I want to give a voice to those who don't have one and make sure that they have adequate resources for their families.
Hi, my name is Evelyn Kanamji. My most memorable thing at PSU is the amazing team and the School of Public Health. All professors are very helpful and I'm grateful for them.
I plan to use my degree to teach high school students about their health and to help give them the skills they need to be even more successful in their adult lives.
How I plan to use my public health degree is to put it together with my psychology degree so I can become a sports psychologist and help athletes prepare mentally and physically for their games and for their careers.
I plan on using my public health degree so that I can help out within different communities and be the voice for those who do not have one.
I plan to use my degree to inspire young minds and challenge their thoughts and ideas, bringing a sense of adventure to their journeys towards their goals and aspirations.
Over the last 4 years, Portland State has become my home away from home. Thinking back, one of my favorite memories is being surrounded by friends at 1 a.m. at the Portland State Library, thinking to ourselves, one day this is going to be worth it. Well, here we are. Mom and Dad, this is for you.
These sutures are soluble in alcohol. But let's rub our hands raw in the liquid of a moment, careful not to touch our faces, not to wipe the tears from the cheeks of our children's dreams of playgrounds where squirrels tightrope green fences to the rhythm of passing cars pulsing cumbia. Let's wave at one another for the first time, like we share more than our present fear, like we cared enough to ride swings together before strands of yellow tape separated games from real life. Look, my heart is full with desires for solidarity, for acknowledgement of a distance that existed long before the sun's outer skin ceded its name to our supposed unifier. My arms are full with warmth for you, for the possibility that our wounds might sting less if we apply light to the cuts beneath our gloves. Still, some hands prefer to build walls, others to be cupped over lips chapped by lies dressed in the garments of science, covering excuses like the coughs compelling our concern. Where were you when our hands were up, when they formed fists to forge futures where our knuckles heal? But let's bang our pots and pans, shout from our windows, balconies, fenced property lines, tents and cells. Let's dance samba in our new Mardi Gras mask, practice mindfulness as they filter our reality. 6 feet is the closest we've ever been. So look, my voice is full with echoes of our past, of presents held together by songs as fragile as the lungs that lift them. My imagination is full with vignettes of sliding boards, of scars that form between us all as the alcohol evaporates from our open hands, and these sutures dissolve into our palms.
Thank you, Dr. Petteway. Dr. Petteway's poem, Together Untethered, was honored with the Interconnection and Community Award during the National Poetry Month in April. His work explores notion of power, inclusion, and accountability through poetry and the arts, and is pushing new boundaries on how we speak about public health. It's a powerful reminder that truly being together requires more than slogans in this time of crisis. That togetherness must become the basis of our new normal. Before COVID-19, I started most days having coffee with a student, sometimes 2 students in a row. Today, I still start my days having coffee. It's just they're virtual coffees. I start my days with my students because I enjoy nothing more than hearing our students' professional dreams, nudging those dreams a little higher, helping them break those dreams into manageable steps, and connecting our students to people who will help make those dreams come true. And as I close, I ask you to take the first professional step of your dream, to ask yourself, what dream will I take on? What would Dean Bangsberg coach me to how to break it down into manageable steps? With whom would he want me to meet to ask for help? And what opportunities would he want me to seek and to seize? Or better yet, just call me. I will have time to listen to your dreams, not only the many steps forward, but also the necessary steps backward, because there is no map for our greatest health challenges. Go ahead, test me, you got my number. Hearing about your challenge, your path, your success is my greatest pride and will be my greatest reward. Find your mission and follow it until we have health equity and well-being for all. I am counting on you. Our faculty and staff are counting on you. Oregon is counting on you, and the whole world is counting on you. And I know that you are the ones who will get it done. But that's for tomorrow, and the tomorrows to come. Today is a day to celebrate, to soak up the pride of your family and partners and friends. So go have fun, go celebrate. Then it'll be time to get to work. But before we do, here are some words of wisdom from Dr. Bill Lambert, who's retiring after 35 years teaching public health, along with some other familiar folks who have something they'd like to say to you as well.
Hi, my sincere congratulations on your achievements. I've seen how hard you worked, and I've been impressed by your commitment and investment in yourself. Remember that public health is a sacred responsibility. You now know what needs to be done, how to do it, and of course, if you do it long enough, you'll reach your goals. Best wishes to you.